Welcome back to MediVista, where health is explained simply, clearly, and honestly. I'm your medical guide, here to break down complex health topics into language anyone can understand, because everyone deserves to know what's happening inside their own body. So sit back, and let's learn together.
Every 8 minutes, one person in India dies of cancer. Not because cancer is always unbeatable, but because it was caught too late. Here is the truth that most people don't know. When cancer is detected at stage 1, the survival rate for most cancers is above 90%. But by stage 4, that number drops to below 20%. The difference between stage 1 and stage 4 is often not the cancer itself. It is the warning signs that were ignored. Today I am going to show you the 10 early warning signs that your body sends long before cancer is diagnosed. Watch this entire video, because one of these signs could save your life or the life of someone you love. Welcome to MediVista, Health Explained Simply. This channel is dedicated to giving you accurate, evidence-based medical knowledge in simple language that everyone can understand. Before we begin, a very important point. The signs I am about to share can also be caused by many non-cancerous conditions. Having one or more of these signs does not mean you have cancer, but it does mean you should see a doctor and get properly evaluated. Early investigation is always better than waiting. Let us begin. Sign 1: Unexplained weight loss. If you have lost more than 4 to 5 kilograms in a short period of time without changing your diet or exercise, and without any obvious reason, this needs medical attention. Cancer cells consume enormous amounts of energy and release substances that alter metabolism. This causes the body to break down fat and muscle rapidly. Unexplained weight loss is one of the most common early signs of cancers of the stomach, pancreas, esophagus, and lung. If you or someone you know is losing weight without trying, please see a doctor immediately. Sign number 2: a deep, persistent fatigue that does not improve with rest. This is different from normal tiredness after a long day. Cancer-related fatigue is overwhelming. It affects your ability to function normally even after a full night's sleep. It happens because cancer cells actively compete with healthy cells for nutrients and energy. In blood cancers like leukemia, fatigue is often the very first symptom. If you have been exhausted for weeks or months with no clear explanation, do not dismiss it as stress. Get a blood test done. Sign number 3: any new lump, bump, or swelling anywhere on the body. A lump under the skin, in the neck, armpit, groin, or breast, that is painless, hard, and gradually growing is a classic early sign of cancer. Important: not all lumps are cancer. Many are benign cysts or swollen lymph nodes due to infection. But any new lump that does not go away within 2 to 3 weeks must be evaluated by a doctor. Never wait and watch a growing lump. Early biopsy can be life-saving. Sign number 4: unusual changes in the skin. This includes a mole that changes shape, size, or color, a sore that does not heal, skin that becomes unusually yellow, darkened, or reddened without cause, excessive itching of the skin. Skin changes can signal skin cancer, the most common cancer globally, but they can also indicate internal cancers. Jaundice, yellowing of skin and eyes, is an early sign of pancreatic and liver cancer. Examine your skin regularly. Any changing mole or non-healing skin lesion must be shown to a doctor without delay. Sign number 5: a cough that has lasted more than 3 weeks, or a persistent change in your voice. A long-standing cough, especially one that produces blood-stained sputum, is one of the most important early signs of lung cancer. Persistent hoarseness or a change in voice quality that does not improve can indicate cancer of the larynx or thyroid. If you are a smoker with a persistent cough, please do not assume it is just a smoker's cough. Get a chest X-ray and see a doctor immediately. Sign number 6. Any persistent change in your bowel or bladder habits. This includes persistent diarrhea or constipation that lasts more than 4 weeks. Blood in the stool, which may appear bright red or make the stool dark and tarry. Feeling that the bowel does not completely empty. Painful or frequent urination with blood in the urine. These signs can indicate cancers of the colon, rectum, or bladder, all of which are highly treatable when caught early. Any blood in your stool or urine, no matter how small the amount, must be investigated. Never ignore it. Sign number 7. Unexplained bleeding from any part of the body. Blood in the urine. Blood in the stool. Coughing up blood. Unusual vaginal bleeding between periods or after menopause. Bleeding from the nipple. Any unexplained bleeding that is not due to an obvious injury must be medically evaluated immediately. In women, abnormal vaginal bleeding is one of the earliest and most important signs of cervical and uterine cancer. Early detection through a simple pap smear test can prevent cervical cancer entirely. Please do not feel embarrassed to report bleeding to your doctor. It is always better to investigate and find nothing serious than to wait. Sign number 8. Persistent difficulty or pain while swallowing. Medically called dysphagia. This is when food feels like it is getting stuck in the throat or chest, or when swallowing becomes progressively more painful. This is one of the earliest and most important warning signs of cancers of the esophagus, throat, and stomach. Many people adapt their diet, eating softer foods, without realizing something serious is happening. If swallowing has become difficult or painful over the past few weeks, see a gastroenterologist immediately. Sign number 9. Persistent indigestion, nausea, or upper abdominal pain that does not respond to normal antacids. While most indigestion is harmless, persistent symptoms lasting more than 2 to 3 weeks, especially in adults over 40, can be an early sign of stomach or pancreatic cancer. Pancreatic cancer in particular is notorious for causing vague upper abdominal discomfort and back pain in its early stages, symptoms that are easily dismissed as gastritis or muscle pain. If your indigestion is not responding to treatment, insist on an endoscopy. It could be one of the most important investigations of your life. Sign number 10. A wound, ulcer, or sore that simply does not heal. A normal wound heals within 1 to 2 weeks. A sore in the mouth, on the skin, or in the genital area that persists beyond 3 weeks, especially one that bleeds easily, must be evaluated for cancer. In India, oral cancer is one of the most common cancers, largely due to tobacco and betel nut use. A white or red patch inside the mouth, or an ulcer that refuses to heal, is a major warning sign that must never be ignored. Please, if you use tobacco in any form, get a regular oral cancer screening done. It takes 5 minutes and can save your life. What to do if you have these signs? If you have noticed one or more of these signs, here is exactly what you should do. First, do not panic. Most of these symptoms are caused by non-cancerous conditions, but do not ignore them either. Second, see your doctor within 1 week. Do not wait for the symptom to go away on its own. Third, ask for investigations. A complete blood count, an ultrasound of the abdomen, a chest X-ray, and a urine test are basic starting points. Fourth, if your doctor refers you to a specialist or recommends a biopsy, go. Do not delay out of fear. A biopsy is the only definitive way to rule out cancer. And fifth, make lifestyle changes now. Stop tobacco in all forms. Reduce alcohol. Eat more fruits and vegetables. Exercise regularly. Maintain a healthy weight. These 5 changes alone can reduce your cancer risk by over 30%. Remember, cancer feared is far better than cancer ignored. Cancer does not have to be a death sentence, but only if we catch it early. Please share this video right now with every person you care about. Your parents, your siblings, your friends. This is the kind of information that genuinely saves lives. If this video helped you, give it a thumbs up. It helps MediVista reach more people who need this information. Subscribe to MediVista. Health explained simply. For accurate medical knowledge every single week from a qualified medical professional. Stay informed, stay alert, and take care of your health because you only get one body. I will see you in the next video. Important. The information in this video is for educational purposes only and is not medical advice. Please consult your doctor for any personal health concerns.